Hi everyone, welcome to AYUSH TV. This is Dr. Pamna, psychiatrist from Akshaya Medical Center, Bangalore. In our previous video, we were talking about common mental illness or a severe mental illness in adults. Now let us talk about in children. Does children suffer from mental illness? Do they usually present with mental disorders? See, most commonly, children present with developmental delay is what we call. Developmental disorders, what we call. Every child has a developmental milestones. That is, at what age they start talking, the speech is developed, at what age they usually start walking, at what age they start communicating. So there is an appropriate age when they start having this development. Whenever there is a delay as a parent you notice in your children, like delay in a speech, it can be delay in the holding of neck, or it can be delay with the walking. I think this is where you should be alarmed. Thorough assessment is needed, because most of the child who presents with this developmental delay, it needs to be assessed, because most of the developmental disorders which is present in the children, it can be trained. We can train the children to cope up with whatever their mental or chronological age is. What are this mental illness, or what are the psychiatric illness mental disorders which they present with? It can be anywhere from autism, ADHD, learning disability, or intellectual disability disorder, what we call. Now, what happens because most of the time parents are very apprehensive to bring the children to psychiatrist, because they are very scared, but the child would be started with any medications. Absolutely not. Because until and unless there is a dire necessary, usually as a psychiatrist, we never start with any medications. Only with the training the parents or training the teachers, we can usually cope up with that, so that the child catches up with whatever the lost developmental issues are. Now, coming to an autism or an ADHD, if the child is having anything with the pertaining to play, like in flapping, hand flapping, or not able to communicate, does not maintain a high contact, or when you call the child does not respond to you, these are all what we call as an autistic features. Now, these features can be diagnosed as early as 3 years of age, even below that. But what happens is, most of the time parents bring the children when they are over 7 or over 8 years of age, when they are having an issues in the school. That is where there is a treatment gap, what we call, from the time of onset of the disease to the diagnosis and the treatment. Now, most commonly what we have seen is an ADHD. ADHD is nothing but attention deficit hyperactivity disorder, where the child is very hyperactive, inattentive, impulsive, cannot sense the danger, always jumping around. So these are all the features. So it needs to be assessed, and we have to train the executive functioning of the child in a frontal lobe, where there are a lot of techniques we can use, so that we can train the parents how can they teach the children. Then having an intellectual disability is what we call, like not being able to follow your instructions, complex instructions or anything like that, then we call it an IDD. The last one is learning disability. If the child is having any problem with the scholastic or an academic performance, I think that is where we can help the children with come up with. Can children suffer with depression or anxiety? Yes, of course they can. I think more than the medications, it's all the therapeutic interventions what we do, like in training them in what areas they are having in weaknesses, or what are the strengths what we can enhance. So all these things is what to be needed in a psychiatric assessment and treatment. I think for this, you have to consult your psychiatrist or take a professional help to get what is that which is needed. If you have any comments, anything to say, please comment, write it in our comment box, and also like and subscribe to our channel. Thank you.